Good morning to all the dignitaries on the dais and off the dais. So let's start in right earnest. The first topic for today's session is work-related ocular injuries, and I come from a industrial city of Punjab, and we see a lot of these ocular injuries, and over a period of last almost more than 20 years, I've been dealing with all different types of penetrating trauma, and I would like to share my experience in ocular trauma. So worldwide there are about 55 million eye injuries believed to occur every year, leaving 1.5 million as blinds. Globally there are approximately 2 lakh open globe injuries with an estimate of 3.5 per lakh per year of perforating injuries. And most of these are work related, and they affect young adults in productive age group with economic consequences for the family, for themselves, as well as for the country. So various studies in India have reported an incidence of ocular trauma to be 1 to 5%. Amongst the total number of blinds, 1.2% is contributed by injuries, which is easily preventable. And the incidence, depending upon the occupation, mainly students, farmers and manual laborers, they constitute the major chunk which get affected. In addition, drivers, factory workers, they can be involved in roadside trauma and can be affected by the work-related injuries. So as per the BETTS classification, open globe injury can be a rupture, which is a full thickness wound of the eye wall caused by a impact of blunt trauma, or a laceration, which is effect of a sharp object. It can be a penetrating injury, which is a single laceration, or a perforating injury, which is 2 full thickness perforations or through and through with an entry and exit wound, and it may or may not be associated with a retained intraocular foreign body. So a penetrating trauma, globe laceration, usually you will see some kind of a dark spot or a streak on the sclera and a jelly-like material coming out of the eye onto the face. And if you have any doubts, assume that trauma to the orbital area involves the globe. So it can be industrial, it can be a roadside accident, and these are one of the few surgical emergencies in ophthalmology and needs to be repaired at the earliest. So one should have a very high index of suspicion for a retention of foreign body, especially if you are able to see an entry wound. The foreign body may be lodged in the AC, lens, iris, or at the vitreous and retina. So there can be a double perforation leading to the foreign body going through the posterior sclera into the orbit. So in our center, we studied 7 patients of open globe injuries who underwent surgical repair at our place. And this was a retrospective study. And based on this, various factors which we evaluated to predict the outcome of open globe injury were the mechanism of injury, preoperative visual acuity, time lag between injury and surgery, and size and location of the wound. Other parameters which can predict visual outcome are whether this injury is associated with retinal detachment, uveal or retinal tissue prolapse, vitreous hemorrhage, lens damage, hyphema, presence or absence of retained intraocular foreign body, and how many number of procedures you had to do for these patients. So we divided these people based on the visual acuity, best corrected visual acuity at last follow-up, and the presenting visual acuity into 6 different groups. Group 1, 2, 3 were the people who were presenting with a good visual acuity or a visual acuity of anything up to 660, and 4, 5, 6 were with the poor visual acuity even up to the level of no PL. So we included no PL patients also in this, and as you all know, even a person who has doubtful perception or no perception of light at presentation may ultimately end up with some kind of a vision, or sometimes even a good vision after interventions or after surgeries. Sometimes even out of scare, especially in children, they may not be cooperative enough to give you the right visual acuity perception. So, various factors which you study were age of the patient, initial visual acuity, evidence of infection or inflammation, vitreous or uveal prolapse, vitreous loss, lens status, and presence or absence of retained foreign body. And at last follow-up, BCVA and anatomical status was recorded. So, preoperative investigations usually included X-ray orbits, ultrasound, and CT scan. And we nowadays rely more on the CT scan findings. So, out of the 70 patients, mostly these were males. And there were 3 patients who presented with no PL visual acuity. And as you can see from the chart, we started with only 9 patients with 6.6 or 6.18 visual acuity, and ended up with 25 patients with a good postoperative last follow-up visual acuity. Similarly, there were 11 patients who had endophthalmitis at presentation, and still out of these patients, a few of these got good visual acuity. At least 50% of those we were able to salvage. Lens rupture and cataract presentation or dislocation of lens was there in 43 of these patients, and they also improved quite a bit with the intervention. Similarly, the uveal prolapse was there in 13. Retinal detachment and vitreous hemorrhage was there in 28. And again, after multiple surgeries, few of these they ended up with good vision, and especially these 9 patients in a visual acuity range of 6.6 to 6.18. Yeah.
Please sum up, sir.
Sorry?
Please sum up, sir. Your time is.
Yeah. So, foreign bodies were 54. And these are a few of these foreign bodies. And I have a couple of videos which I think for the paucity of time I will skip. Just to show that these are the few patients which may end up with very good vision at the end. So, I will not go through these in detail. So, this we have already discussed. These kind of signboards should be there in all industrial places to prevent, and all out efforts should be done to prevent the the injuries. To conclude, a lack of good information system on injury burden, its pattern and impact prove a barrier to injury prevention. Occupational health policy was one of the components of national health policy. However, still very little attention have been paid to mitigate the effects of occupational diseases, and awareness and attitude of workers and employers towards safety norms are partly responsible for low compliance. Thanks a lot. Thanks a lot for your patience.
Very good study, I think, in industrial area. So one thing that in your study, out of 70 patients, only one female is
yes,
there.
Sir.
So is it related to their less number of female is working in industry, or any other reason that you have less number of female patient?
No, that's what I'm saying. Most of the times the males are more affected by especially the penetrating injury or severe injury, because the most common cause is either industrial or a roadside accident, even farmers and some students, drivers. So these occupations mostly are dominated by males. Of course, these can be with the females as well. And the other thing might be that females mostly they work in unorganized sector. So they may not come with the kind of a ESI cover or something, and the employer may settle this without being referred to a VR specialist or a tertiary care center. So awareness is a must, and coverage of industrial employees is also an issue.
So which type of foreign body you got in these injuries?
Sorry?
Which type of foreign body you got most of?
More of these were iron foreign bodies or a metallic foreign body lodged inside the vitreous or sometimes into the retina.
Besides the coverage, you have already shown thickly posted on the most
Yes, sir.
of the industries. I would just suggest that
Yes, ma'am.
I would just suggest if it is possible in your area, you can talk to the SI people and at least get that reinforced to give them safety precautions to be reinforced. Because that
Yes, ma'am, we keep doing. The only problem comes with basically like in spite of our insistence, and especially so in the organized industrial sector, the awareness amongst the employees is very less. Even if these safety glasses have been provided by the employer, they will not use while working. They feel that it hampers their view or something, and they don't even know when something is going to hit their eye, and they'll end up in trouble.
that nobody can predict when
Yes,
it's going to hit their
yes.
eyes. So
Okay, okay.